evening, everyone. So this is our 16th Engage CME. And we've had a lot of fun. At least I think we've had a lot of fun in these 15, 16 weeks. Even in February, which had only 28 days, we did properly 4 Thursday CMEs. So before we start, I just wanted to ask you all. So you can unmute and say, but you're enjoying it. Are you finding it useful? Number one. Number two, earlier we used to have, some of you will remember that we used to have Thursday in a month, once a month, we used to have CME. So our old people some of them are asking whether, we can have once a month, but we can't do Rosidea or any serious study with just once a month, right? So I was thinking maybe if you all give your opinions, one of the Thursdays we can have just a normal CME, like we used to do earlier, cases discussed or something else, so that other people who can't manage for whatever reason, time and other things, to study this whole thing, can do that. So just give your opinion on that. How do you feel about it? Okay. So let's start. Today we have lots of cases, but the subject is rather big, so we'll have cases next time. Okay. So we have been studying Rosidea, we've done Rosales, one family, we've done Maytails, we've done Sadales, and now we are doing Malpighiales, right? So as we did till the number 3, we had finished 47 remedies. Even in Malpighiales, we did last time 5 or 6 remedies, and today we'll do 2 or 3. So yeah, so we'll have done 50 more remedies. So next time you again give another opinion on 3 things I'm asking you. So you want to do one kind of a revision. Can you hear me? Somebody's written, can't.
It's clear, madam. Voice is very clear.
Thank you. So the third thing I'm asking you is this, whether next time you want a full kind of a revision till now. So let me know. So today we are going to do 2 very, 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 very important remedies, because we have been using them a lot, and but we've been using just very, very minimally, right? Coca and Pacifin. So we've been just using it for very limited kind of thing. So let's look at the big picture. And then we've already done Bani, C, lot of time we spent. We've done Carico, papaya. I've even used Carica papaya folia for patient with low platelets and CLL. So we're waiting for results. Then we have another, we've done Viola Odora, or they are balanced. We have to do them, I think. So we have done Bani C, we've done germanium, we've done Chol Mugra. We just touched, Dr. Praveen had told us it's for leprosy. Boric has written this for leprosy and the skin syphilitic. Yeah. We've done Carica papaya. We have done Carica papaya folia. So many remedies we have covered. Okay. Today we are going to do Coca and Passiflora. Then we are left with Viola, again very important remedies, Viola Odorita and viola tea. Then Ratania, again, we use it very limitedly, but we all use it in anal fissures and so on. And then Seneca. So we'll be doing these few remedies, even this, which is actually, I want to do it because it is made from flaxseed. We are all using flax seeds a lot. So, from when we look at the six subclasses, so the human journey, we know the first one is not here, not there, right? So they come from the outer world and come to this our world. That is the first subclass, the Magnolidae. So, and then we go from subclass 1, 2, 3, 4, 5, 6, and then back to the other world. So from there we go back. So this return path has already begun now with the subclass group of Malpighians. We'll see that, okay, with these two remedies. We saw that in Bani C. You remember that nice picture Dr. Fatima had given us about the head opening up and the soul going up, right? It said whole and not soul, right? That was the very nice, catchy line. Okay, so this Malpighians group has many drug remedies. The drug remedy means they give a high. We saw that in Bani Scapi. And so they travel to other worlds, the people who are in this, they travel to other worlds. The soul kind of escapes from the head. Okay, can you see this picture nicely? See, its soul is this levitates, so it's going away. So our remedies are coca, which is very high spirited. We know it's a drug and sometimes misused. And we have passiflora, which is a drug like cheerfulness, drug like paralysis, and then sleeplessness. So we all use, I use passiflora mother tincture, for sleeping. So these are all going to be remedies we use in small ways. Now we are going to expand and see the bigger picture and the bigger vision. Okay? So the most important remedy we'll do is coca, the cocaine. So there'll be a lot of stories about drug high, low, non-connection with reality. So let's have some fun. It's called erythroxylum coca, which is in brief coca. So it belongs to the family Erythroxylaceae, and it grows in the high Andes mountains. The cocaine alkaloid is prepared from it and used as a stimulant drug, and affects the brain and then the muscles. So the brain is confused, doesn't know where it is, it's on a high, it is not connecting, it is connecting, living its own life. And then it affects the muscles, which go no longer in their control. So chewing these leaves allow the Indians, we're not talking about we Indians, we're talking about the Indians, in the original inhabitants of America and so on, wherever they were called the Indians who already lived there. So they allowed the Indians to endure the oxygen deprived conditions of high altitude. We use coca for nausea when you're climbing on the mountain and so on. So there is oxygen deprivation, and that in those conditions, they could bear it because they chewed on these leaves. So God has always given us a solution for any problem that you have already at hand. Like arnica is found on the slopes again of mountains or hills. And if you fall, so it's called the fall, things like that. So consequently, this remedy has problems with height. It's also a bit like glyphosate. So when one uses cocaine, what is one thing? We are the king of the world. Anything is possible. I can do anything. Okay? Homeopaths will tell you, we can do anything. We can cure anything. Right? हम है ना सलमान शाहरुख खान, right? मैं हूं ना. So other drug-like properties are inability to get angry. They're very calm. And then get dissociation with whatever is the reality and the lack of concentration. So the split is between what one wants to be and the way one really is in reality. Okay, so one thinks, well, I think I'm king of the world, but I'm not, right? So that is what we want to be, and what we really are, maybe just a copy. So a lot of stories. They can tell a lot of boastful stories also, like other remedies like opium and other things, where they tell you so many boastful stories. You know, I'm going to meet the PM today. And he's not even gone out of this small town or gone to Delhi. He's telling you stories. I'm going to meet the PM this evening. So big bombastic stories, big braggarts and so on. So his need to achieve and accomplish is contrasted with the feeling of failure, which is seen in this order. And this can be seen, why? Because when you climb also, why should you get nausea? So nausea in high places, airplanes. So there is a lot of fear also of height, and you get nausea with it, which is characteristic of food. So lot of height issues and the need to fulfill very, very high standards. Yeah? So a lot of desire. I want this also and I want that also. And the poor mother is all loaded up. So dreams of grandeur. They want to do great and big things and think they are the king, but they are maybe failing. So possibly, you know, we find this, we say diya tale andhera, no? Or in a big oak tree, under that there's shadow. So the people don't grow under it. So you have this classic example of this jumping jack who was so successful in actor, and his son didn't do so well. Oh, Vinod Khanna, his son didn't do so. So I always liked him a lot. Anyway, so possibly they are people, the Koka people, whose parents were of a high status, okay, public figures, but they themselves don't manage. So unfortunately, they may use the same medium. Means if they are doctors, they may use that. Or if they are actors, like I gave you example, they also want to follow that profession because they've been brought up with it and they have been, you know, doing it. So, but they don't be successful because box office success is so much dependent on how people accept you. Yeah. So it is not to do so always with talent. Not that I'm saying he was very talented, but his daughter did quite well. But she branched off, you know, a bit. So it is for people who have been exposed too early to success or fame. So they think that is the norm. Okay, so when you're in success all the time, you think everybody is like this. So you're rich, you're well-to-do. You think everybody is like this. Like we have our great story of King Siddhartha, no? The prince. So he never knew there was anything ugly, old age, nothing. Then he got a. So Koka people invest a lot in their work. They are hardworking. They work until late at night. And this is the masculine achieving, right? We have come to the fourth group, and now this is the third and fourth row, which are oral and early childhood. So they invest a lot in their work, working late at night, so which is masculine aspect of achieving. Later, they cannot fall asleep. This is common in so many of us, no? Students or we who work very hard. If I prepare lecture, I may sleep at 12, then I don't get sleep. Then I say, oh God, how am I going to do tomorrow? So like that. So students, workers who exhaust themselves are high-tech professionals. So then you feel severe self-criticism. Why didn't I do it? And here you can see she only, herself only is shouting at herself. Okay? Leads to failure. Say I didn't do it, self-reproach, self-criticism. And the rubric is washes his hands all the time. But some of the rubrics are really nice. We may not, we may look at just at failure, or we may look at self-criticism. But washing hands all the time is a big thing of feeling done wrong somewhere. So there's a restlessness in their actions. We also have a very high sense of responsibility. With responsibility, always is guilt, because responsibility means fastidious, rule, so much to do. And then obviously somewhere you will fall short. So they will feel guilt. Or they will feel that they will never live up to those high expectations which their father made them drilled into them. Okay? When he was teaching the rules and the norms. That is called internalization of a meticulous and invasive figure in their life. This is the fourth row. Okay, fourth row is early childhood, right? The third row is the anal control. So they have to, Foka people always feel they have to justify their existence. And we must be okay all the time, because they have to grow, they have responsibility, they have to give to the others, look after the others. So they have to be okay. So in the beginning, they'll be quite responsible. They're working hard, but untidy. He said, look at the room. My God, what a messy room. Yeah, he's not put away clothes which he wore yesterday, day before, and so on. I don't put anything back in its proper place, because with everything else, I have to be in control. Yeah, when you're dealing with somebody, you're looking after somebody who's sick, you have to, like Cinderella, or like John, like our the person who did all the mineral study. So I'll get it in a minute. So you have to look after somebody, means give properly medicines on time and all, be very fastidious. So all that you have to do. So with this, I let myself go. Only in this I let myself go, because everywhere else I have to be in control. So the actual symptoms from a case by Yaku. They feel that they are doing so much, but they are not respected enough. They invest so much of their time, their energy, and everything, looking after everything, but they don't get so much respect. So then they think about it, intellectualize. They want to do great things. It seems they help others. They think they are helping others, but actually they are indifferent to others' sufferings and maybe egoistical. We have a rubric which may not apply here. The sadness at others' misfortune, or he felt this thing when his brother felt overboard, he felt the same feelings, or rubrics like that, or sad, horrible stories affect him greatly. These are some of the rubrics which can come. So they think they may do, and they may be indifferent. There's always two sides. Okay? Today, for example, we had a patient who told us that, he is so sensitive to other people's suffering. Even if he sees, I couldn't understand this. If he sees the watchman eating down in the table, just eating on his lunch break, he feels so sorry for them. I said, but that's where they eat. But he probably feels they don't have a place, dining table, or food, and he feels very sorry. So that is like taking the suffering to heart. Okay, so you may have remedies like. So these are children who want to be treated as if they're important, because they have come from this rich and well-to-do, well-placed family, and they think they themselves are also. So the higher they reach, where do they fall? And lower. They succeed. They may succeed too early, along with high expectation. They want to be responsible, to be all right, to carry all this weight. But then it's not easy to keep on carrying the weight, and they may fall. So constantly working overtime to reach great heights in career and business. So, but he's all the time in shadow of his father. And the child always feels that he will never grow up. If he sees his father's penis, he said, my penis is so small, will never be like that. So that feeling of being small remains sometimes. Yes? So in the shadow of his father, can't live up to expectation and so much all the time justify himself. And therefore, they are very sensitive to criticism. They themselves self-criticize. If somebody else criticizes, then they feel even worse because then they think it is all available to everybody to see them now. So when they do mountain climbing, there are these two feelings. One is feeling too risky because they've got out of their place of security, and there's always threat when they're outside of falling, especially in mountain climbing. And the most important thing is the nausea which they feel. The second feeling is that one is expected to perform and reach great heights, far beyond the ordinary, far beyond even their capacity. So they get breathless and they get asthma. So you have nausea, you're breathless, asthma, all to do with flying. So they want to have a great social position, but the ascending is a problem. And they don't want to also leave their place of security. So very ambitious, must climb great heights beyond the ordinary, do great things, but they're also introverted, isolated. Okay? Because they are in drug state, so they don't connect so well. Whereas Zyko have all these same things, but it's an extra. So the father theme, the masculine is, father sets the theme, he must be first. Oh, you came second. So the girl said, I came only second. But second is very good. No, but my teacher felt I should have come first. So then you can never win. Okay, you have to be happy with whatever you do. That is the whole thing. So coca is a drug remedy, so it will always do these too much ambitious, too much hiding, too much achieving, thinking that they are good. So even Freud and Sherlock and all, it is said that they used to have cocaine. So sometimes to get over everything, you may have to, take something. Because while climbing mountain, you get many of them. He likes seclusion, but he must attend, must reach the social position, all mountain climbers. And they have to do the 4-dham yatra, right? Our 4 dhams are, Puri, Badrinath, Rameshwaram, Dwarka. How many of us, sometimes we leave it right till very late and then we can't walk so much, but maybe we should do it all of them. And the feeling is because they're isolated, they feel that they are not achieved enough. Okay? And they may feel impotent, socially shy, fear of crowd. So everybody's here, but she's all alone. They have problems with self-expression and cannot express anger. So then it is control. Again, inner state, third growth. So they have to control, don't express. And then in the end, they withdraw, do not want company. You have to think of autumn, but the dreams are bound by roads. So a lot of industry we saw, a lot of way to exert themselves, trekking, going on mountain treks, going on other treks, and also, which is also very common with many drug remedies, which we know, opium, very good example. Painlessness of complaints usually painful. And then fear of height, because the fear is always of falling, and they fall sometimes lower. So the need is always to reach greater. So like cannabis, opium, other drug remedies, and other drugs themselves have beautiful vision and need to achieve and accomplish, but may not accomplish. Okay? So if the first son wants to be just like his father, I'm special, then he fails, he's not achieved. Father is very disappointed if he doesn't achieve. So then he withdraws, he's alone and socially shy with fear of crime. See the boy hiding and thinking that he is on a cloud, thinking that he's very high, but he has problems with expressing himself and even expressing his anger. So at this gap between what his high image is and his actual self, which is so low, this widens. As you grow, you widen. As you're small, you think what your father's doing is what you're doing. His success is your success. So you're successful as when you're small. Everybody also treats you, like a prince, very good. They look after you and all. But as you grow bigger and get out of your father's shadow, you realize that you are not so successful. You'll see this in some cases. The father dies or the brother who's helping him that's not there anymore. Then he can't manage. So his sense of self increases to the point of feeling emasculated. Means what? No feelings. Case where, like for example, somebody said, who would you for a promotion? And he was told that he'll get a promotion. And then he doesn't get. So that thing of not, first, if he had not been told, he wouldn't have felt so bad. When being told and you expect, you're looking, when they're going to announce the next promotion, you're expecting. And they announce somebody else. I mean, you should see their face, how it just falls. Okay. So that is one disappointment. Then you're doing a project and you fail at that. So these are feelings of, especially in the male, they're feeling of castration. Castration is again penis cut off, right? So can be related to fatherly criticism and all to a repressed masculinity. So in the male genitalia, you feel as if penis is absolute cut off. Loses a sense of masculinity when the business fails. So like Aurum, fear of falling from high places. Aurum is the mineral remedy. Coca is the plant. So you may deteriorate to the point of drug or alcohol addiction. And then there is this serious, when it's addiction, you have it once in a way, it's different. But if you start from morning, and continue through to the evening, then it causes a serious inner split and completely you lose your sense of self. So first we saw over-responsible, overworking, later loss of control and forsakes all responsibility. Then again, he loses all ambition. They began with very hardworking, wanting to achieve, thinking he's big, thinking he's a king, very responsible, doing for others, thinks he's doing for others, and think he's everything okay except his own personal belongings, which we saw. But later, when he has failure and something, then he loses control, his responsibility he doesn't want, ambition goes, and then the choice you become addicted to drugs or alcohol. Then there is this serious inner split, okay? And fornication on the tongue and skin, loss of taste in the mouth, and a lost sense of self. So there is this major difference between inner sense of responsibility and the altered stage of loss of control, right? Up to insanity. So you may give up drugs, you may alcohol, and then finally insanity. So they withdraw and you may have even catatonic schism. So when they lose control, forsake all responsibility, they stop doing anything. So they just reverse. No purpose, just sits and does nothing. Sits and does nothing. So the rubrics that we have, and luckily we have these rubrics, and so it's not that we can't come to Coca with all this source, not just for nausea, just for mountain climbing, but it is for lot of depression, going into addiction, illness from shock when he didn't do well, much ambition, competitive audacity, confidence, then lack of. So it alternates or it goes into. Then you have panic attacks, alternating moods, occupation they like, which helps. But they are so sensitive and they offend it so easily, right? Delusion parts are missing and fear is overpowered. The rubrics are industrious, mania for work, delusion, voices here, unpleasant. About himself. That delusion prescribed he is. My autocorrect, it all correct. When I write nicely type he, it becomes the. So everywhere I've had to take it out. So one or two remain. So because he himself has such this low self-worth, self-criticism, so he constantly gets delusions also that voices saying that you are no good, you're a failure, who are you, such a small man, look at your father. So all these kind of things, and then it can become, I go into schizophrenia. Delusion criticize he is, I told you this mistake. Isolation sense of that nobody really cares for me. Nobody said it's okay, you'll do well. Okay, this business failed. Maybe, you have a different aptitude or something. They just shout and say, you are not successful. Father says, I invested so much time in you and you didn't make anything out of it. And very bashful, very low image, feels very sad. So coca is the main remedy for asthma and difficult breathing from tobacco, dyspnea with pressure on the whole chest, and a continuous desire to take deep breaths. Difficulty breathing even when in bed with palpitation and oppression, and while coming down also the mountain, panicking. So dyspnea with heart. We've seen nausea, we've seen asthma, difficulty in breathing, see oppression on the chest, palpitation, panic, and addiction. So there's also weakness of vocal cords with the hoarse voice. Because anything which has to do with breathing and all will affect the vocal cords. Emphysema and dyspnea from slightest occlusion. Dyspnea in the elderly. Altitude sickness. Oh, I don't like to go on these. That drive to Nasik is too much. When it goes up and all, I feel very bad. I would rather go by train and some easy way. So he avoids traveling. Asthma, wanting to breathe deeply and wanting to be alone. The other people won't look at him and say, what a failure, what a sick man. Yeah? Pressure on the chest and buzzing in the ears, which is again a part of altitude. Short breath on ascending with oppression. Because he has to be big. His father was a mountain climber. He also has to be a mountain climber. But I cannot. Want of breath. So because of this pressure, the heart will also become weak. So you have respiratory along with the emphysema on slightest expression, altitude sickness, breathless, nausea. Other main things are, we've already seen as if penis is not there, emasculated, sterility and varicose, okay? Which also allows you to be sterile. Painless of complaints usually pain. He likes to do things, play, but he no longer has the strength to, because he's fallen so much. So that was coca. Our second remedy is passiflora. So it is called Passiflora incarnate. Yes? Passi for short, to friend. The friend is called Passi, to everybody else is passive. Excuse me, is there a question? So the common name is passion fruit. Actually, it I think is a misnomer because the name of the plant comes from passive flower, not passion fruit. Relating to the calming and sedative effect of this tincture. So you take it for sleep because it relaxes, calms you. It loosens and relaxes muscles, and it is also an antispasmodic. Muscles, all the places are relaxed. So even where there's pain, it's relaxed. Muscles relax, your pain goes. So it's an anti. There are many names it has. Maypop, purple passion flora, true passion flora, wild apricot, and wild passion. In southern US, we saw in cultivation for its fruit and striking bluish kind of a color, purplish. And shape of a chakri, you know this, see here. Can you see this? You know that chakri which we put in Diwali, go round and round and round and round, called chakri. That is the kind of fruit. So it is used for anxiety, insomnia, or blood pressure, high blood pressure. In traditional times, it was also used for diarrhea and the stomach. The fruit juice is also good for persistent cough. Right? Found it used. So again, it also belongs to the row fifth subclass and the fourth row, right? So a lot of work, right? It is a early childhood. So a lot of work-related stress and inner alert. They live in an overly organized. Whenever you're organized, you're always very particular. Then you're always very tense because everything must be in order, under control, which is mostly anal. Everything comes from the mind and they cannot let go. What is about anal? Control and cannot let go. So when you cannot let go, then it's very, very troublesome because your mind is always tense and always working and always feeling that you've not done enough. So there's a lot of restlessness and working while or find work tedious. So the brain is in overdrive constantly because when you're overtly organized and when you have to be responsible, you have to take everything under control. You have to constantly plan and think and plan and think. So right up to delirium tremens, right? When you cannot control anymore. And acute mania. This, I don't know if all of you have read the book, Who Moved My Cheese? Who Moved My Cheese? So it's a nice book about two mice, and then they go and they have to find two mice in this maze, and they have to find it. And each time they go to a different place, they achieve, and then they both get separated. And lots of stories like that. It's a good book. So we use it for a lot of things, especially delirium tremens. When you've gone to the stage where you cannot work anymore and you cannot control anymore. So you have dealing with the world and work with rigid, meticulous diligence. But when a leap is necessary, because you can't keep on working like that. Finally, you have to go to a stage as you grow, and you have to go to take a leap and take different decisions. Then this rigidity prevents them from advancing. So they are not so creative, right? Lack of inspiration, lack of passion. So these are all feminine qualities. And we know that this is the column which feminine has to be crash, 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 and the masculine has to do. So that would, feminine quality only would motivate them to create, right? Create, do something new and take this new place. So it is also a carcinogenic remedy, very over-responsible. Responsibility exhausts them, ailments from worries, much pressure and tension, then severe hemorrhoid because anal. So control also at the anal, severe hemorrhoid, bulging eyes, pressure on the skull, epilepsy. So stress leads to depression, agitated and pressured feeling, contractions slow down or cease. sleeplessness from tension, exhaustion, overexertion, inability to let go. In sleep, you have to relax. But if you can't let go, you can't get sleep. The constrained thinking, did I do everything? Did I forget something? Did I do it properly? Did not do? Did I shut off the gas? So a lot of OCD can come in from compulsive thoughts. Even thoughts compelling children in. So very early also they can get. They repress their feelings over the course of the day. And by bedtime, there's letting go, which causes immediate wakefulness, right? So you suppress your feelings. At night, you say, okay, now let me see what I did, what I didn't do. And you may let go, and then you have wakefulness because you think, did I do it, did I not? So achievement-oriented and stressed out, but they do not manage to fall asleep at night and are then very irritable and violent the whole next day. So then when you're not, you clench your teeth and jaws and then get up wondering why I didn't sleep well, why I'm so tired. Because there was constant clenching of the jaws and grinding of the teeth. Sleep is restless, filled with anxiety, leading to hysteria and palpitation. And then they I must use something. So, my 8:30 drink is very important to me so that they can relax, calm themselves. As long as it's one peg, but when it becomes like addiction, then that is a it's a spasmodic remedy because anything which is contracted has to loosen with this remedy. And to sleep, you have to loosen. So we know that's a remedy which allows you to loosen. Anal is the third row, which is about control. So children, when their teeth are budding, they are restless, screaming. The inner stress and constant alertness lead to spasm, nerve problems, painful nerves, and stiffness. You may even get tetanus and lockjaw. Okay, you may have a dog bite, for example, and most people, may not get any. The children or from this row may get tetanus or convulsive fevers in children, even epidemics. So rigidity of the muscles and the neck and shoulders, of the abdomen, and then if there have been wounds, they always get some problem. Just dog bite or something. And Lilienthal a lot of treated many horses, tetanus of horses. Okay? So they begin with this lot of excitement, lot of wanting to work, lot of ideas, lot of many things, and say, okay, I know what I want to do. I'm very self-aware. I will grow up, to be very successful. And then it may not happen. Then he becomes irritated. Every little thing irritated, saying, I didn't finish because you disturbed me at work. And then gets angry and blames others. And the self-awareness then becomes very sensitive, very sensitive to outside impression like noise, pain. And then they start taking either drugs or alcohol. So you have later alcoholism, drug, mausoleism, and business people to overcome sleep. So then when you do all of these things and you become more dependent, then all this earlier responsibility, excitement, wanting to do things, working very hard, all that becomes very slow, you can't concentrate. Any little interruption, your work is gone. Forgot, oh God, what was I doing? So confusion of the mind from interruption. Easy interruption. Weakness of the memory. What was it? Oh God, what was I going to say? I forgot. I just on the tip of my tongue. It happens once in a way to all of us. But when it happens too often, then it becomes pathology. Frustration of mind from mental exhaustion, slowness of mind. Takes the pillow, wants to sleep, can't sleep, big eyes, all the time thinking. So neither sleep nor tired. So you have all these rubrics also, okay? And for all these things, it is useful in Passiflora, not just for sleep, like just a sleeping tablet or a sleeping tincture, but you can treat alcohol delirium tremens, drug addiction, abuse of narcotics. It helps you break the morphine habits like a wine or something. Acute mania, excitement and spasm. Neurosis of children, alcoholism, delirium tremens, I already said, drug addiction, insomnia even of the infants and the aged, first childhood and second childhood. So it can have insomnia all through the ages. Either young, even the children's mind work too much. And then, when they're trained too early, given a lot of bedwetting training or things like that to control. And then they become too obsessed with all that, and then they don't sleep. They become very restless. So from other materia medicas, Shankaran will do later. He has said that the remedy never been proved, but it is widely referred to in homeopathic literature from his book on Insight into Plants. So Dr. Lind's experience with this remedy, you have in Hales Materia Medica, fair quoting Dr. Lindsay's experience. In private practice with Passiflora, very rewarding. And he had a very good opportunity during the war in a military hospital, where there were many cases of syphilis, which he managed so successfully, with this remedy. So you have right to the syphilis. So it is useful for tetanus with opposite tetanus, complete. Delusion, body parts are missing. We said, penis is missing. Lying on a blanket. So miasm probably is syphilis, and the proposed sensation could be destroyed by disturbance. So Shankaran's, if you look at it, it belongs to the violins family. So violins summary is sensation words, aversion to being disturbed at the physical level, pains are cutting, stitching, sharp, pinching, lancinating, everything is penetrating. Yeah, at this stage of anus, where again abuse is very common, where you're very curious, going to look at things, want to look at the genital, and then you can be easily taken into sexual abuse. Many of these remedies we've been talking about. At the mental level, you have vexation, chagrin, and this disturbed feeling. So one is on one side physical and mental penetration, the sharp stitching pains, and you have vexation, chagrin, and the mental. Passive reaction is frustration, morose, avoids people, stays alone, sits there so that nobody comes, sees him, or talks to him. Active reaction is very angry when questioned, violent. He tries to control his anger, but then he cannot. Then malicious. And then there is rage, and there is restlessness. And then there is insomnia. And so you have active reaction, Shankaran's analysis, passive reaction, and the compensation is what they want to become. Is quietness, calmness, and stillness. Beautiful. Then I can sleep well, get up well, fresh, and be able to do all my work and all my lectures and all my talks. So let's do some cases. We have this lady who was promoted suddenly. Yeah? You think promotion is sudden. So if you're prepared already and don't get it, then also it's a problem. If you're not prepared and you get it, also is a problem. So she was a 32-year-old girl, suddenly promoted to manager from being a clerk. Very different, right? Clerk is to follow order, manager is to give order. So very different roles, whether you can do it or not. Pressure was so much she could not handle. So she was sleepless from stress. The workers were senior to her and would not listen. She is still immature and her age is toddler. In her age is toddler. Yeah, both. So the anger and the suppression of that anger because they didn't listen to her, and she again from the role to the masculine role where she's coming in. So it makes us think of Rosidea. The controls anger, can't handle stress. So this is toddler with control, suppression, and sleeplessness. Row 3. We have column 5 and 3, which where it crosses, that is where malady ends. So because it was sleep and couldn't do it, so it took Passiflora. 1M1 was calmed her and she could sleep. Case 2, male 42, pressure was so much in business, he went into deep depression. Because he has started the business with the brother. I told you, na, brother or father figure or whoever helping him, his partner suddenly goes away or dies or becomes sick and he can't handle alone. So his brother was bedridden and the patient couldn't handle alone. But he couldn't share his feelings with anybody because everybody said, तुम इतने साल से काम कर रहे हो तो इतना नहीं हो सकता है क्या? Brother is there, no? Bedridden, he can give you advice or he can talk to you. But he couldn't share anybody. So he started alcohol and became later addicted. So loss of sleep and continuous business thoughts. Okay. So again, toddler stage, column 5 with this responsibility, masculine coming up. So passively home. Yeah. Anything? Question?
How is Passiflora different from
Brian is
Brian?
a long-term runner. I told you yesterday also, last time, that Brian is like very stable, very responsible, doesn't give up easily at all. Here you see, he can only be responsible if he has support and backing. And he is the third, and so it's a very different, it's a short-term run. All these remedies here in these groups of womb, oral, inner stage, early childhood, and the fifth subclass, they're all very short-term runners. Now, business he has done with the brother, he could have handled, but he didn't. He got addicted and went for a toss, right? And Brian is so stable. Though you have the same thing, you also have disturbed noise, light, and may have headache, just similar to Brian. But Brian will overcome that and get back to you. It's a very conscientious and very dependable one.
Thanks.
So another case, this female was unmarried. This is from Clark. So here there was a family history of insanity. Father was in the asylum, so we know that there is mental imbalance, constipation. And so again, same thing, gave Passiflora at 7 o'clock, 8 o'clock, 9 o'clock, 10 o'clock. Well diluted in water. In 1 week, she was better. In 1 month, she was able to sleep 7 to 9 hours. And this was a girl who couldn't sleep 3 hours. Another case, a 54-year-old man after a nervous breakdown. So the cases, yes, you will tell me we've been using Passiflora, so what have you told us new? But you use Passiflora just for sleep, but you didn't know that it was for much deeper causes than just sleep. And it was too much activity and too much at the fifth column and the third and the fourth row of anal and childhood, with deep depression, inability to take responsibility, therefore thinking, nervous breakdown, even for addictions. So earlier he was very successful, active, leader and dependable, and not accustomed to share his distress with anyone. So they are loners, no? They are quiet. They find it difficult to express even their normal voice, their normal kind of communication is very, but when they are distressed, they don't share at all. So when he collapsed, again another autocorrect, when he collapsed, severe anxiety began with an inability to fall asleep. Some nights he wouldn't sleep at all. So not only could he calm down with Passiflora, but he was able to let go, come back, and start working again. That is the thing. Any sleeping pill, what does it do? Just give you sleep. So you take more. And you take, and you take, and you take, and then you take half, you take 1 minute, 1.5. These are sleeping tablets. It doesn't do anything to take care of the cause or the problem or what was the thing inside you, right? So this takes the whole picture. So it makes you not only sleep, but also go back to your business or give up your addiction, take away your depression. So, case 5. So this woman is already on psychiatric meds. On top of it, she married a man who already had a daughter. Yeah, here. Remember what is this movie? Famous movie. Was already unusually, remember? So he married a man who already had a daughter. And this situation, she is small with herself. And with anal and early childhood, she is also inner age is low. So she had to find maturity and maternal qualities that she was not ready. So a lot of anger inside. She couldn't release it. And so she got insomnia from all this anger and tension. So the remedy calmed her. She was able to fall asleep, able to take charge of the whole family and of the daughter. So that is what a holistic remedy. So we've shown how much bigger it is than just sleep. Important remedy we've seen for sleeplessness, due to depression and other things, tremors, epilepsy, and a lot of addictions, drugs or alcohol. So that was our 2 remedies today. You all wanted to do the one-liners, so we can do that. And before that, tell me, did you find this being going forward, being useful to you? Yes?
Yes, ma'am. Yes, ma'am. Yes, ma'am.
So tell us,
Yeah.
can you think of any case where you can give it?
Yes,
Yes. Okay. Sorry, Rama, you finished, then I'll tell. Okay.
All right. All right. So there is one case recently, as I was preparing for the SSMS and COCA picture I did a little more reading about it.
Yeah.
And this was this young girl, 17-year-old, board exams happening, going to start 12th class, and very ambitious, very hardworking, and this feeling, no, I can do anything. There was, for example, a competition in her school on how quickly one can finish a Rubik's Cube. And she didn't know, but she taught herself in 2 months and she came first. She won the gold medal. Very intelligent, very hardworking, very good looking, wants to become a model, but also wants to own her own business. She wants to go to the US to study. I've given her all kinds of remedies, Rustox, Carcinosin, including Silesia, because she used to have this image. She'd always have this anticipatory anxiety, and then you'll ask her what happens, why, what is the problem, since you've studied so well and you know you're going to come first. No, but I'm not reaching my standards. My standards I'm not reaching. That used to be her key word. This time, when her father, and her basic complaint used to be sneezing, sinusitis, and some skin issues. The skin issues went away with Medorinum very early. But the sneezing was her bane. Anytime she would have this anticipatory anxiety and she'll have sneezing. From Sabadilla to Vayatya to every kind of remedy I have given her, nothing works. Second time, it will not work at all. Obviously, it's not her remedy. So this time I gave her coca. Single dose, 200, to be put in water and had over 3 days. And then I gave her in bark flower elm. It's a week now. There's been no complaints from the father. The father has come for somebody else in the family, but there's no complaint about this girl. I'm keeping all fingers crossed. I think she's Coca. Thank you. It was thanks to this preparation that I really studied Coca in detail. I have given it empirically based on the not knowing the subclass 5, but gave it for a diabetic who had impotency. In boric, it is one of the big remedies for impotency in diabetes.
Can you make your video?
Sure.
Open? Preeti, can you help her?
Yes.
Yeah.
So I have given it in that in empirically, and it has helped. That man has already started exercising, and he says there are certain days where I'm feeling fine. I mean, there is no flaccidity at all. So, and it was just Coca 30 for a week. So now I've given further. I'm waiting for all the blood sugar results.
So very good cases. So we can see how much it helps more
Oh,
than
yes.
just a drug remedy or for
Yes.
just for drug addiction of alcohol. And the same thing with passiflora, you have the breathlessness and all that. Yeah. So actually, I really love this column because there are so many remedies which you've been using over the years and only, in just small way, right? Mother tinctures and so on. So then when we have the big picture, we really think. Yeah, Rashmi, you wanted to share?
Yeah, Vishpala, I have used Passiflora in so many cases, and most cases it gives very good results. And today the problem is so prevalent, sleeplessness. So I feel sometimes I feel like using it like OTC drug,
Yeah.
and it's would be much better. And 2 cases was so interesting. Like
So
one
how do
lady,
you use it, Rashmi? How do you use it?
I use in drug form, and before sleeping, about half an hour before sleeping, they can take in drop form 5 to 10 drops in half cup of water.
Yeah.
And it has mostly worked. And one lady, she had given up on her sleeping tablets on her own because she was sleeping very, like waking up not so fresh. So she just gave it up, And then she was so restless when she came to clinic. She was pacing up and down. I gave her Califos I must have given. Then Passiflora helped us so much that she wanted it every day, for such a long time. She said, you just give me that medicine. And so that was one very interesting case. And another case I'm having right now. So he had very, like all nervous, all the symptoms that you gave in Coca, all the rubrics were there. So he's a professor in a college, 54 years, and it's like situation like who stole my cheese. I'm not telling in a very detailed manner. I had given Aurum at first, and then while interviewing, I asked him, what is troubling you the most? Like he was this all work and no play and no holiday in so many years. So he was completely, it was like nervous breakdown. And he said, I want to sleep. Trey says, I need to sleep. I need to sleep. And earlier I'd given Oramet, it helped a bit. And then he had acute fear also. So stramonium also. But Passiflora is after 2 or 3 days, he says, he was afraid to take because he had so much work, afraid to take in the sense he slept so well. He said, I sleep so much, then maybe I'll not be able to finish my work. So this is also very interesting. And the way you took the case, Vishpala, was very good. Cases and everything. Yeah.
Thank you. So yeah. So we can see, and that you thought he just gave for sleep. But I'm sure that man is able to work better, not having negative thoughts, so
Yes.
it helps in so many ways where we don't know.
It helps even babies and infants. I give for whooping when cough, in the night, and you have all these young mothers complaining they're forever coughing. Can you give me something instead of a cough syrup? Passiflora works like magic, 10 to 15 drops in half a cup of water.
Yeah. Ravin Kumar always says 20 drops, but I use 10 drops.
Oh, it begins at even 30 drops, ma'am. I have a diabetic patient who swears by Passiflora wherever she goes, and she begins at 30 drops. And if needed, you can repeat it after an hour or two. No residue in the system, no habit forming.
And you get up fresh. That is the
Yes,
whole
yes,
thing.
yes.
Very good sharing. Anybody else wants to share? Even people who are now new, we have done 3-4 months, so people can start sharing. Yes. So you want? I
I want to share a case of retania in a young man who is 30 years old.
Rama,
came-
just show yourself.
Okay. So it's a case of severe constipation with anal fissures. Initially, I gave nitric acid, but nothing happened, and neither he could able to sit nor he could stand. Like it was so painful. One day, so he came to the clinic, and he was really that receptionist came inside, and he was telling, "Madam, he couldn't stand. He seems to be crying also. Something you give him immediately, Bolke." Then Retania I gave. It really helped. Like that day, the Wednesday was there. So again, I called him on Friday itself. So by Friday itself, it has given him a very good relief. Like he could able to sit. So of course, further some other remedies also, calcarea silicata has come subsequently, though I gave that, but this has done really well.
Tanya has this, as if a bunch of sticks are in us, that kind of a feeling.
Yes, because at that time, though he was not able to tell anything. Like even if I want him to talk also, ma'am, you give some medicine to relieve this pain. Because earlier also same way in one student I gave. So that came immediately to handy. Like sometimes what happens, what I was, finding is in acute cases, I think some experience already we have to have, so that it eases our, because even while taking, he is not telling anything to give some medicine to relieve my pain, because I know on nitric acid I already gave, but nothing happened. So yeah,
Tanya is better by warm or cold?
that I have to see once, because I was telling, as Dr. Rama was telling empirically, this was on the basis of this only I gave. I'll just see. Yeah.
So one of them, nitric acid, is better by cold. Retania, I think, is
The sensation in Retania is of broken glass in the rectum.
Broken,
glass or sticks, inside.
Yeah,
and
yeah.
Yeah. So
Sometimes if the totality is coming, that's okay. But sometimes even that also, severe pains, and he was telling pain. That was only the thing he was telling at that time.
Yes. At that time, they can't sit, they can't stand. So it's
Yeah.
So no worse.
I relieved by hot water only.
Hot bath.
A hot bath only, yeah. So that was one. Retania, of course, 3-4 times it has come to as a rescue remedy, I can say. Like, yeah.
I've had great results with Retania.
Retania, okay.
We have for all our fissures and all our, we have these 4-5 remedies which we use. But we never go beyond that, no? So
yes,
the idea is to go beyond.
But I think in these kind of things, I think some antisoric has to be given, I believe. Subsequently, though, of course, definitely maybe the Retania in subsequent doses, it would have helped or not. That's again.
Yeah, because you can give a potency, na?
Potency, yeah, potency only.
1M they've used. Other tinctures. So.
Of course, Retania I gave in potency only.
Yeah, because that is
that's
not there. 30-200.
So that was the experience. Like 3-4 cases, it has come to really good handy.
Yes, Dr. Rama. Very nice to share.
Yeah, thank you.
What have you decided about? You want to do next time revision and we are doing a lot of COCA cases and Lazarus case and all that. So
Ma, I have a suggestion that
Yeah.
just now Dr. Rama Pinawai, what she says is nothing to do with this medicine, what we are learning now. But I request after you complete whatever the subject we are talking, those who want to share this kind of quickly the short experience with the great success, they can share. They can share. And it will be really appreciated by all, I suppose. Am I right?
I think so.
Yeah. I mean, you mean to say like it should be emphasized on the Erickson model of
No, means she's saying that if people share their own
prescription?
experiences,
What exactly?
much
Because
more impactful.
experiences will help to further understanding of the Rositz family. Yeah. Okay.
Okay, madam. So your question was, please ask everyone what you want to do.
Yeah, I think the revision is important because this is such a vast column, and every family is a
Yeah.
little different. I think periodic revision, however many times we do it, it will still be useful. Secondly, this 3+1 seems fantastic. 3 Rosidea, 1 CME, regular CME.
So we may have little different groups, but that's all right. Yeah, we can just, all of us, of course, will join, and there may be some new people also. Okay. Smita says she had given COCA for hoarseness of voice. Maybe it worked with excellent results. Smita, you want to share it? Talk? You've written, so. Don't feel shy now. We're a small, close family group. Yeah. Okay. So thank you for sharing, Smita. So we have done these one-liners, Fabils, My Tales, all these we have finished. So Malfigales. Yeah. So what is the general column size?
Could you make it full screen?
Yeah,
please?
sorry.
Thank you.
So general column size and row 3, 4, we know anal stage, control, holding on, and it's difficult to attain this, to autonomy. So there's failure, there's self-doubt, there's self-reproach. We saw it in all the remedies, including today's 2 remedies and last time. And the row 4 is early childhood, lot of play, curiosity, and therefore we see sexual abuse with penetration. And also the control, so OCD, initiative is there and then stuck and paralysis. So they say it is a delicate ego turns rigid with dealing with the other. And when turned rigid, then you have hardening of issues, your joints, jaw, we saw tetanus. So when we have this feeling of a part falling off or atrophy, emasculated, penis missing, and respiration, the responsibility aggravates we saw, perfectionism, competition, ambition, tension. And also we have seen, what it is said is that you are in the dark and the whole process is walking through it to see the light. So the connection with God and going into the other world or even in this world to light. We had seen last time that picture of, beautiful picture of dark and then meditating and light. So this is general. Now Bani C, which is a shaman, you know what a shaman is, right? And Aushka, I've shown you the pronunciation, A-W, Aushka. So it is freeing the soul from the body. I made a joke also, right? That you can be the best doctor because you know from clairvoyance, which is the disease. So Bani C, right from being very laughing all the time and gay, becomes dark. And maybe because adopted, so there is this feeling of not being, not belonging. And we had seen a case also where there was in the family only, she felt somebody was abusing her. So can't trust family. When you have mistrust and trust issues, and you can't trust your father or your family, we've seen cases where fathers rape the daughters, then you are nowhere, right? You have no one to depend on. They should come and tell you, कोई है ही नहीं जो मुझे कुछ advice दे या कुछ बताए या I can lean on them. So feels very alone. Dreams may be of trauma, of death, failure. And whenever there's failure, it drains all energy, but it also drains the sexual energy. So it leads to impotence. Then we've seen that two lives, two worlds they live in. There are two lives. So like a CIA agent, we had given an example. So yeah. So basically it is like harmaline is the hormone, like serotonin, yeah? It opens up the third eye. And whenever the third eye opens up, you get nausea. So there is nausea, not only while mountain climbing as in Kosa, but when the third eye opens up. Because finally, Banis is also a narcotic. And again, it is also opens up spasm. So anti-helminthic because of the penetration. So not only other things penetrate or sexual abuse, but even worms. Then toothache, we have said better buy a kick, right? And the famous phrase, whole not soul. Disconnection, danger, drug, alcohol addiction, all that. Sorry. Okay. Then we did Karika papaya, which we said diuretic and cardiac stimulator. So it has both heart versus weak versus kidney versus sexuality versus skin versus allergy. So feminine is very low. So slow sexual drive is the end of the feminine quality. So there are problems in birthing, colorful sexual dreams because it can't really perform and doesn't want. Restless sleep, just like you have in Passiflora Coca. And as it is a band. Here there's lice, again, penetration. Allergy, eosinophils are very high. And the other is always looked on as a threat. Me and the other is the column. But till you get used to the other and till you communicate and deal with them, it will always be as if the other is a threat to get you out. So he thinks there's so much trouble already in the world. So why should I do anything? Very negative. Then Carica papaya folia, which is from the leaves. For low platelet count, I told you I already got it from the medicine. And I've given it for splenomegaly, CLL, hepatitis. Damiana, which Dr. Praveen corrected my thing, it is Damiana. So it is a lot to do with being, again, emasculated, easily discouraged, very sensitive to criticism. It will go in the whole row. Failure. So, but Damiana, again, I've given to a patient. I can't tell you what happened. But impotency in mother tincture, 20 drops. Either you give it just at 8 o'clock before or BB. Then Chaul Mugra is just a 2-liner. We didn't really do it, but Dr. Praveen brought in the remedy. It is a specific for leprosy and the syphilitic state of the skin, boric cells.
May I interrupt here, ma'am?
Yeah.
For Chaul Mogra, I remember Dr. Ranga Krishnan using it as topical in Q form for a syphilitic phase of psoriasis. She never gave anything internally. She never gave anything internally because it was a very elderly person. So she only used it topically and it helped.
So mother tincture?
Yeah, mother tincture.
Mother tincture topically. Yeah, even this also I heard and I saw in the thing like
yeah,
some
she used it in
unit. Yeah, in some
coconut oil. Coconut oil.
In coconut oil.
Yeah.
Oh, okay. This was
Twice a day.
diluted in water and they used to apply. Yeah.
No water. This was specifically coconut oil.
Okay.
In 50 ml
But
coconut oil.
Applying it, there's no point in putting
just
water. So yeah, coconut oil is a better.
She twice a day, I think for about 15 days it was given. And after 15 days, there's definite improvement. And after which she then gave the constitutional remedy.
Okay.
So, Harika papaya folia, religious, also addiction to alcohol and cancer. You know, that case said cancer penetrated me. Remember, he was that man who was very religious, and he had, he would do his puja for 1 hour, and he would only eat and late at night, only one idli or something. So, very, very religious. And then his addiction, he got cancer, and he said cancer has penetrated him. Then he was having tobacco and he just kept it in mouth and then threw it out because he was told not to have it. So it is good for platelet, low platelet, and for cancer. Okay. Erica papaya, ambitious, confused, Alzheimer, peripheral neuropathy, indignation, hepatitis B again, like folia, liver, here there's spleen more, and milk, can't take milk at all. And again, like all of the whole row, importance in men and sterility in women. Then we did geranium maculatum. Feminine is becoming less. So what happens? Fluids are leaving. Fluids leave. So you may have menorrhagia, bleeding. It's from the uterus, from the lungs, from the kidney, from the retina. Leaving. So you become dry. Excess secretions of foul odor. Then in the old days, treated diarrhea, constipation, and colon cancer. So issue is what? When to hold on and when to let go. So row 3 is over retention, holding on, anal stage, and attachment, or to let go. I think that is it. We had done till last time, right? Today we'll have to add coca and passiflora. Then I want to do linoleum. That's a very small remedy, but because it is flaxseed and we use it, we'll do that. Britannia will do the bigger thing, and we'll see what else. Yeah. So these also, so many of the remedies we can start already using. Okay. So Kariga papaya folia we can start using. I believe Baheti has it in Pune. We can ask for it. And
Senega also one of the important remedy. No? Senega.
Yeah. So we can see in this this family has Senega.
Yes, yes. Next to
Yeah.
passiflora.
So we'll do Seneca here. So we'll do Seneca, we'll do Viola or Budara and tea, which are both very important. This lino is the one which I was saying, flaxseed. Britannia will do. Then most of the others.
What was the third one? Second one, Balismenesis.
This one, Carica papaya, impatient.
No, above that.
Chow. This is Chow Mudra.
No, next, just beneath the Chalmugra.
Impatience. That is one remedy from bark flower. No?
Bark flower.
Bark flower, yeah.
So then we've done coca, we've done carica, we've done germanium. These others are very small. Ratania will do. Linoleum, nitroleus, flaxseed, Bani we've done. Ouch and oxal, maybe they're small remedy. Plasma we've done. Senega will do, and vial. So we have 3, 4, 5, 6 remedies to do.
Is this oxalic acid? Oxalidase, oxalic.
Yes, must be.
And above that,
About that ouch, I think
OCH.
OCH is okra. 1 second, I'll just.
Yeah.
So it is not oxalic acid, it is oxalis acetosella.
Okay.
Oxalis acetosella.
Okay.
So it is more to do with grief. Okay.
And above that?
Ouch. Ouch is not given in the book at all. So I don't know. And linum catharticum is the one which is flaxseed. So it has vertigo. when the head is bent backwards. That is the only important thing in that remedy. And then you have, of course, Tanya, we know. Seneca, we know a bit.
Hmm.
Mm,
Old man's bronchitis.
yeah, correct. It's mainly for old people and lot of secretion. And then Viola odorata, we know, but we not use it very big way. So that's an important remedy with the cases and Viola tricolor. So that is, with that we will finish the whole group, this group, malphigians. And then we go to euphorbarians. That is very, very important. So not too many remedies, but important remedies. We have Mancinella in that, we have Jura in that, we have Euphil, we have Stilinga in that. So nice remedies. So we have nice time. And the best is that we know some of these remedies and now we can do
Yes,
bit of it.
exactly. Yeah.
Nice fun, nice.
Thank you, ma'am. Thank you. Lovely
Thank
class.
you, thank you, thank you so much.
Thanks.
you very
Thanks, Dr. Thanks, Dr. Rama, Dr.
And thanks, Dr. Ramaz, both of you, and Rashmi. Thank you so
and
much.
Rashmi. Yes.
Yes. Yeah.
Lovely cases.
Hosting us
Lovely
also
cases.
nice.
Yeah, bye.
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 Thank you, Smita. Thank you for sharing, Smita.
अच्छा हुआ ना डाला ना अरे उसको बोलने का है अभी नहीं उसको बोलने का है अभी कल से ही है ना ओके
Okay, Preeti, thanks.
किधर का है ये मेरे को लीव मीटिंग नहीं ये मीटिंग खत्म